Today I work with a client who's been dealing with some bilateral numbness and tingling in her hands. Now, she's had several procedures and I wanted to walk through those with you. She had a bilateral carpal tunnel release as well as a disc replacement in her neck, and yet still having some numbness and tingling in the hand. What we identified is something called Thoracic Outlet Syndrome, which is entrapment of the nerves in the scalene muscles in the front of the neck. There's also some facet pain going on, showing here on this map. So we were doing some mobilization techniques to help alleviate some of the facet discomfort. We identified the nerve entrapment here in the scalenes, and you could feel that pain down the arm. So we're doing some active release techniques with our hands and then with the Theracane. We then moved into some myofascial decompression with active movement to help take some tension off the mid-back, as well as some shockwave in the neck and the lower back for some facet pain that she's been dealing with. We then moved into some myofascial decompression with movement of the lumbar spine, again for some of the facet pain that she's been dealing with, also with some lumbopelvic movement, and as you can see here, the facet pain map from that L4, L5 region that she's been dealing with. The set of exercises we're going to go through is cervical retraction in quadruped to help get the longus colli and longus capitis muscles activated. We then moved into gentle rotation only to 30 degrees to get the semispinalis, multifidus, and rotatories muscles activated. We then moved into lateral flexion and extension with the band on the side of the neck. This technique here is for facet gapping bilaterally. So we want to do both legs so we don't cause compression on the contralateral side. One of our biggest problems is lumbopelvic rhythm. So we use this pelvic rocker to get the anterior and posterior pelvic tilt as well as lateral motion going. Piriformis stretching is very important, so she's been doing really well with that. We then moved into multifidus activation and standing with a cable. As you can see here illustrated, the multifidus and rotatories muscles are the ones that go over the facet joints. So we worked on that with a cable rotation, then in half kneeling, crossing over with a resistance band to target those multifidus muscles to work the contralateral side. So she's doing great with that, so keep up with it. We then progressed with some Roman chair extension exercises and then decompressing the spine as we go over that. Sumo squats to focus on the glutes and not so much the lumbar spine. Good form. And then we finished up with some suitcase carries bilaterally. Reach out with any questions. Until next time, aloha.